Good afternoon, and thank you for joining us for the fourth session in our series, Exploring Your Health Indicators, and today's topic is kidney health. Just as before, at the end of the survey that we'll be sending out following today's session, there'll be a link that will provide you with the website where you'll find all of the different recordings and any other resources that we have added for you. Today's webinar is brought to you by the University of Florida IFAS Extension. A couple of Zoom features, just in case. If you're not familiar with the platform, if you hover down at the bottom of the screen, you can see the few icons that will pop up. And the one I want you to be most interested in is that chat feature. And so once you click the chat icon, it should open that chat box on the right or somewhere on your screen, and you'll have the opportunity to either send a message directly to us as panelists or to post for all participants. Quick disclaimer, this information provided is for educational purposes only. Reference to a commercial product does not constitute an endorsement by the webinar team members or the University of Florida IFAS Extension. And here's today's webinar team. We have Kimberly Bragg Armatrout. She's an extension agent in Family and Consumer Sciences with UF IFAS Extension in Hillsborough County. Melanie Taylor, extension agent in Family and Consumer Sciences, UF IFAS Extension in Bay County. Hi, I'm Wendy Lynch, RSA, FCS, and Food Systems in St. Johns County. And Dr. Wendy Dahl, Associate Professor and Extension Specialist with UF IFAS Food Science and Human Nutrition Department. And last but not least, Julie England. She is an Extension Agent Emeritus in Family and Consumer Sciences. A very special thank you to Daniela Rivera Mendoza for developing our slide sets for this series. And with that, I'm going to turn it over to, I believe, is it Kim first?
Yes. Good afternoon, guys. Thank you for joining us. We're going to talk about the kidneys today. And we have two kidneys. Each of them are the size of your fist. They filter and return fluid to the bloodstream every 24 hours. The final product we excrete is urine. And the excreted urine has been stored in our bladder for up to 8 hours, 1 to 8 hours. Next. So our kidney functions are to remove waste products from the body, remove drugs from the body, balance the body's fluids, release hormones that regulate blood pressure, produce an active form of vitamin D, and control the production of red blood cells. Next. So kidney disease usually affects both kidneys. Although many forms of kidney disease do not produce symptoms until late in the course of the disease. There are 6 warning signs that we can look for, though. One of them is high blood pressure. The other one is blood or protein in the urine. There's abnormal creatine and blood urine nitrogen values, a low glomerular filter rate, more frequent urination, particularly at night, and puffiness around the eyes, swelling in hands and feet. Next slide. So if you're measuring the kidney's function, a healthy kidney removes waste and excretes fluid from the blood. Blood and urine tests show how well and quickly that the kidneys are doing their job. Serum creatinine and glomerular filtration rate, or the GFR, or the blood urea nitrogen, the BUN, these are all tests that you can take. Urinalysis, urine protein, microalbuminuria, creatinine clearance are all measuring the function of your kidney. Next slide, please. So why are these tests done? Well, we need to make sure that a diagnosis, if any signs of symptoms of kidney disease. There's a screen for kidney disease if you have diabetes, high blood pressure, or other conditions. The tests monitor kidney disease treatment and progression, also monitor for side effects of drugs that may be included in kidney damage, and it monitors the function of kidney transplanted kidneys. Next slide. So the kidney function, or the serum creatinine, a waste product that comes from the normal wear and tear on muscles of the body, can vary depending on your age, race, and body size. So if you're a woman, your normal range is 0.59 to 1.04. And if you're a man, it's 0.74 to 135. A high blood creatinine level may be an early sign that kidneys are not working properly. As kidney disease progresses, creatinine levels rise. Next slide.
All right. So I'm Melanie Taylor, and I'm in Bay County Extension Office. I'm going to continue on with the different blood and urine tests that we have for kidney function. We also have the glomerular filtration rate, which is normally called GFR. That's why I don't say that other the full terms usually. They are the measure of serum creatinine, which may also be used to estimate how well your kidneys, or excuse me, how quickly your kidneys filter blood. That's your GFR. The normal range when you get your blood results should be 90 or above. A malfunctioning kidney would be 60 or below, and high risk of needing dialysis or kidney transplant would be 15 or below. That would definitely be where your doctor would talk to you about doing something drastic. Basically, the formula for calculating the GFR takes into account the serum creatinine and other factors such as your age and gender. Next slide. Your creatinine clearance. This measures how well the kidneys filter your creatinine, which is the waste, out of the bloodstream, which you would excrete into urine. Usually it's determined from a measurement of creatinine in a 24-hour urine sample that you would collect, at home, and from a serum sample taken during that same time period. Basically, a creatinine clearance is reported in milliliters of creatinine per minute per body surface area. You can see here we've got the age groups. Men, basically 19 to 75 years old. It should be 77 to 160. And then women's changes based on their age. So you can look at your age group there and find where you would fit in. The lower number within your age group might be a sign of a poor kidney function. So for example, I'm in the section with women 40 to 49 years old. And so if I was a 67, I would be more concerned than, of course, if I was 146. So you want that number to be higher. Next is the blood urea nitrogen, and that people refer to that as the BUN. That comes from the breakdown of the protein in the foods that you eat. And as the kidney function decreases, the BUN level will rise, which means that you will have more protein showing up. The normal range is 7 to 20 milligrams per deciliter. As the kidney function decreases, the BUN level rises. Basically, it's measuring how high your blood urea nitrogen level is, which means if it's high, then your kidneys are not functioning well. It can also be a sign that you could have a urinary tract obstruction, heart failure, a gastrointestinal bleeding, dehydration, a high protein diet, and several other factors. So it's definitely something your doctors would want to check on to rule those things out before they ruled out kidney failure. Next slide. The kidney function can also be tested with a urinalysis, a microscopic examination of a urine sample, and a dipstick test will be taken. The dipstick test changes color based on the excess amounts of protein, blood, pus, bacteria, and sugar. It can help detect a variety of kidney and urinary tract disorders, including chronic kidney disease, diabetes, bladder infections, and kidney stones. So that is a pretty thorough test that can pick those things out of the urinalysis. Next slide. Next is the urine protein. This may be done as part of a urinalysis or by a separate dipstick test. It shows the excess of protein, also called albumin, in the urine. And if you have this, if you do have excess protein in your urine, it's called proteinuria. Let's see. You can see here that a positive dipstick test would be confirmed with a quantitative measurement such as your albumin to creatinine ratio. You can see here that the normal range for women is less than 25, and the normal range for men is less than 17 when you're checking those lab reports. Next slide. All right, so now we're going to look at the microalbuminuria. First of all, a good way to remember this is micro stands for small, albumin stands for the amounts of albumin, which is protein, and then urea equals urine. So you're obviously looking for those the proteins that are in the urine, and hopefully you have small amounts. You can see here, it's a more sensitive dipstick test, and it can detect a tiny amount of protein called albumin in the urine. Normal range would be less than 30. Moderately increased range would be 30 to 299, and severely increased would be 300 or above. So those are the types of things that you're looking for when if the kidney function is becoming poor. Next step, or next slide. The steps you can take. Of course, if there's any concern about any kind of kidney disease or kidney function, you need to stay in contact with your healthcare provider. Have your blood work drawn regularly as they prescribe, and your urine. Regular wellness checks. Make sure you're also scheduling just your regular wellness checks, even if you don't have any symptoms of this. Every year at least, we want to be able to say that we've had a wellness check with our doctor, and they do basic blood and urine panels. Maintain a healthy diet. If you know that you've got some chance of kidney disease or kidney function that's poor, you want to make sure you're eating a healthy diet. You also want to get regular physical exercise or activity. And of course, this is something you want to discuss directly with your doctor too, depending on how poorly you feel. But the more physical activity you can get in, the better, because it will keep you from losing so much muscle mass. And you want to drink plenty of water. Obviously, all of us, if you've had kidney disease, have been prescribed different amounts of water to drink. Dialysis patients I know typically drink less water. So if you are experiencing any kind of kidney disease or kidney function problems, then go ahead and check with your doctor before you make sure you drink plenty of water. And you always want to consult your doctor for any of these things. Make sure you're going to checkups, make sure your diet is what they want you on, make sure you're getting regular exercise that they approve, and that you're drinking the amount of water that they want you to. All right, next slide. So in conclusion, basically in generalities, we have two kidneys whose main function is to remove waste products from the body. And just so you know, some people are born with one kidney, and that works also, as long as they keep it healthy. For tests, blood and urine tests show how well and how quickly the kidneys are doing their job. For signs of kidney disease, be sure to be looking for things like blood and include blood and protein in the urine, more frequent urination, puffiness around the eyes, and swelling of your hands and feet. And then to monitor your kidney function, to make a diagnosis or control disease progression, monitor your blood for creatinine, your GFR, your BUN, and your urine for protein, blood and microalbuminuria, and creatinine clearance. Those are regular tests that your doctor will be doing, so you should be able to find those on your lab report. Are there any questions?
Thank you, Melanie, and thank you, Kim, and we'll take questions in just a second. Just wanted to remind you guys that we will have that final survey. It's a short survey, as the others have been, and we greatly appreciate your feedback. We had such a great response, and again, thank you so much for that. Also, here are the resources from today's session. And also wanted to say a very special thank you to Daniela Rivera Mendoza, who has developed all of our slides for this series. Thank you so much, Daniela. We appreciate your time and efforts and research to take care of these slides for today's talk.